You invest weeks studying for an important test. On the big day, you wait nervously as your instructor hands it out. You're working your method through when you're asked to specify ataraxia. You know you have actually seen it previously, however, your mind goes blank. What simply occurred? The answer depends on the complex relationship between tension and memory. There are lots of types and degrees of tension and various types of memory, but we're going to concentrate on how short-term stress affects your memory for realities. To begin, it assists to understand how this kind of memory works. Truths you read, hear, or study becomes memories through a procedure with three main actions. Initially comes acquisition, the minute you come across a brand new piece of info. Each sensory experience triggers a special set of brain areas. In order to become enduring memories, these sensory experiences have to be consolidated by the hippocampus, affected by the amygdala, which highlights experiences associated with strong emotions. The hippocampus then encodes memories, probably by reinforcing the synaptic connections promoted throughout the initial sensory experience. Once a memory has been encoded, it can be remembered or obtained later on. Memories are stored all over the brain, and it's most likely the prefrontal cortex that signals for their retrieval. So how does tension impact each of these stages? In the very first two phases, moderate tension can actually assist experiences to enter your memory. Your brain reacts to stressful stimuli by releasing hormonal agents referred to as corticosteroids, which trigger a process of threat detection and threat response in the amygdala. The amygdala prompts your hippocampus to consolidate the stress-inducing experience into a memory. On the other hand, the flood of corticosteroids from stress promotes your hippocampus, likewise triggering memory combination. But despite the fact that some stress can be helpful, severe and persistent stress can have the opposite effect. Researchers have actually tested this by injecting rats directly with stress hormones. As they slowly increased the dose of corticosteroids, the rats' efficiency on memory tests increased in the beginning, however dropped off at greater dosages. In human beings, we see a comparable positive result with moderate stress. However, that just appears when the stress is connected to the memory task, so while time pressure may assist you to memorize a list, having a friend scare you will not. And the weeks, months, or perhaps years of continual corticosteroids that result from chronic stress can damage the hippocampus and reduce your capability to form brand new memories. It would be nice if some tension also helped us remember truths, however regrettably, the reverse is true. The act of keeping in mind relies on the prefrontal cortex, which governs thought, attention, and thinking. When corticosteroids promote the amygdala prevents or decreases the activity of the prefrontal cortex. The factor for this inhibition is so the fight/flight/freeze reaction can overrule slower, more reasoned thought in a harmful circumstance. However, that can also have the regrettable result of making your mind go blank throughout a test. And after that, the act of trying to remember can itself be a stress factor, leading to a vicious cycle of more corticosteroid release, and an even smaller sized chance of remembering. So what can you do to turn tension to your advantage and remain calm and collected when it matters the most? Initially, if you understand a stressful situation like a test is coming, try preparing in conditions similar to the difficult environment. Novelty can be a stress factor. Finishing practice questions under time pressure, or seated at a desk instead of on a couch, can make your stress action to these circumstances less delicate during the test itself. Exercise is another beneficial tool. Increasing your heart and breathing rate is linked to chemical changes in your brain that help reduce stress and anxiety and increase your sense of wellness. Routine exercise is also commonly thought to improve sleeping patterns, which is available and useful the night before a test. And on the real test day, attempt taking deep breaths to neutralize your body's flight/fight/freeze response. Deep breathing workouts have revealed a quantifiable decrease in test stress and anxiety in groups varying from third graders to nursing students. Let us hear from you in the comments area below. Enjoyed this video? Hit the like button and show your pals. Also, subscribe to our channel for more videos like this. Thanks for watching.